Hey, it's Dr. Rosie. So thank you so much, you guys, for such the high interest about the deep cleaning. I was actually kind of laughing about the comment that you guys had said it looked like mushroom pieces. I was like, I could see that. I totally get it. But I just kind of want to share basically more in answering the questions that you guys had. There were so many questions and comments that I couldn't get to, so I figured I'd just make a video, just kind of basically answer as much as I could about it. So let's break it down. I'm Dr. Rosie, by the way. I have been a dentist for 21 years, so I'm really excited. I love taking care of my patients. I love educating and motivating and just creating a really positive experience for my patients so that they want to continue to take care of themselves and feel comfortable to see me. So this patient that you guys saw in the video,
was such a satisfying,
I know, it was kind of wild
process. This
the
process
reason why is that
close to
he
3
was
hours
so
with our
fearful
patient.
of going to the
So
dentist
what
after
we're doing
his
is
bad
called
experience, traumatic experience,
or
from
terms
the
of dental
orthodontist
terminology,
at a young
we
age,
call
I
it
think around
scaling
16
and
years old.
cleaning.
Crazy, right?
And
like
this
you're
device,
like,
of
just
course,
an orthodontist. He
only
didn't
done
get
in the
any
dental
type of
office
like
is an
cleaning
ultrasonic
or
scaler,
extraction or
also known
fillings.
as a cavitron.
It was so bad
and
that
what
it
does
turned him
is
off.
it has
And
a
you guys
frequency,
understand, like,
vibrates,
if something
and then it
turns you
also
off
shoots water
and it
so
creates
that
such a
we
bad
can
experience,
properly
you do
remove
not
the
want to
hard
be
minerals
near
that's
or
caked
experience
on
that
to the tooth.
again in some
And
fashion,
if you guys
some
are
sort of
wondering
way.
why your teeth are
And
yellow,
because of that,
it's because
he
of
just
this.
wasn't willing
So
to go to the
please,
dentist. And 20 years
do
had
not
gone
attempt
by.
to try to bleach
And
your teeth thinking
he wasn't
that
really
will resolve
experiencing
it.
any pain.
Unfortunately,
Mind
that's
you,
not the case. But if you notice
he
how the
was
teeth
just
are
also
getting
now it
whiter,
created an embarrassment
because once we
he
remove
noticed his
all
teeth
of
were getting
this,
yellow.
it
Now,
does
I
start
didn't
to
know
expose
this at all.
the enamel,
I was just
which
told by his wife that
covered
he was scared, had a
Now,
really
you're
bad
probably
experience.
also wondering, what
And she's
is
been a
tartar
patient of mine for
calculus?
3 years.
Well,
Even their kids, their
how I explain
3-year-old
to
and
my
6-year-old,
patients at
have been
the
also
office
coming to me
is that
until
tartar
finally, I
calculus
guess
is
his
just
daughter,
basically like
you
mineral
know, of course
calcium
she's,
deposits.
she's like, I love going to see
Just
Dr.
imagine
Rosie.
if you didn't
And I had such a
squeegee
great
your
experience
glass
that
shower
it
door
finally
on a
gave
regular
an
basis.
ounce
If you notice, it starts to
some
form
type
all these
of
hard mineral
comfort
deposits,
and to realize, like,
and then
okay,
of course
I can
you
do
can't
this.
properly
I can take that
clean
first
off
baby
the
step
glass
to
shower
actually
door with
get
just
into
like
the
a
dental
wipe
chair
or
and
even
sit
with Windex.
and get an exam and
Exactly.
x-rays
This is what
and
that
see what I
is.
have.
It represents the
And
same
I commend him for
situation.
that because it took
So,
him a
of
while.
course,
And I
over
wasn't
time,
pushy.
you're trying
I
to
tried
brush
to create
harder and harder.
very
It
safe,
doesn't come
comfortable
off,
space.
but it actually
Never pressured him when I would
buildup
see
to
him.
form.
I'm just like, hey, whenever you get a chance,
And you can
come on,
see
see
it's
me.
just coming out in
And
chunks.
I just left it
and
as is.
I'll be honest,
And
it
I'm
is
really
so
grateful for that,
satisfying to
that
do
he
this
finally
process.
took that initial step
I always
to
think
come
a
see
deep
me.
cleaning is
And
like popping a pimple.
there's a lot of other
honestly.
factors, you guys,
That's why I
that
love
it's
watching
not
those
just
pimple
due to
popper
fear.
episodes
It could be
and
also
videos.
not knowing how to brush
But
very
as you
well
can
or
see,
floss.
by
You guys understand,
removing
we
this
never,
is allowing
ever
the
were
gums
taught
to properly
properly
heal.
brush or floss.
Now, I know
I
the questions
didn't
you
even
guys
know
do
how to
ask
brush or
is,
floss.
will the gums grow
At
back
all,
or the bone?
at my age, when I got to
Unfortunately, it
age
can't
25,
back
I
on
didn't
its
even
own.
know how to floss. It was
There
wild. I learned that
is
in
no
dental school,
way
you guys.
since it's
So you guys have to
basically lost,
understand,
and
we
as
didn't
you
get a
can see,
manual
it
whatsoever
starts to
growing up.
slowly
We had to
eat the
figure
gums
shit
and
out,
the bone
right?
away.
So
Now,
he tried his
of course,
best.
the goal is we're trying to slow down
And
the
that's
process.
why you saw that buildup. He
And
just didn't know how to
basically
do
keep
it,
the
didn't know
patient
how to
now on a
handle it,
maintenance
and it just
schedule.
became a
But
bigger
a
and
deep
bigger
cleaning
problem
shouldn't
over
really
time.
be done all the time.
You guys
I always
understand,
look
this
at it, it's just like a
applies
tune-up
to a lot of
car.
aspects
And if you
aspects
come
in our life.
regularly for the
That
oil
if we don't
change,
face it,
that's what's
confront
gonna help
something,
keep it.
it'll get worse
But
and
the
worse
goal
over
is
time.
to keep your teeth
Kinda
until you
like
die.
your broom.
And because
You're not
that way
clean
you
it,
can
and before you
actually
know it,
chew,
it is a
enjoy
hot
food,
mess. It is
and
so
just
dirty,
really have a great standard
disgustingly
life of
dirty,
care.
and you're just like,
So,
oh, and it's
but
gonna
all
take
that
you
stuff is
hours, or
coming
let
out,
alone maybe weeks to
and
clean up the room.
basically,
So
I can see
hence
was
the
having
patient
an
got to this point.
accumulation of
And
all
it's totally
of it.
fine.
I'm kind of
not
collecting
here, to judge.
here, like a
I'm
bone
here
collector,
to make it
but
a safe space.
but
And
yes,
my
please
process
see your
is a little different
dentist.
at my office.
And
I
if
really
not, you
try
guys
to
are always
make my
welcome to
patients
hit me
feel
up. I'm
comfortable,
always doing free
not
virtual
judgy whatsoever.
consultations
I
via Zoom.
purposely never use words to make them feel guilty. Like, that's the last thing you want, is to feel guilty about the decision you made. We've all been there. We've done stupid things in life, but the last thing we want to hear is, how stupid are you? Or like, oh, why did you let yourself get into that? I know I got myself into this. That's why I'm here. I'm here to get help. So we always start with the appointment with a proper exam and x-ray, go over everything, find out what had happened so that I can help that person physically and mentally get through this. Now, everybody's different. I get that. And that's what I do. I tailor it to them to make sure that they're comfortable. And luckily, this guy only needed a deep cleaning, some antibiotics for his gums, and gum laser therapy. He had no cavities whatsoever. That's how great his teeth are. He is so blessed. And of course, it's genetics too, right? Genetics plays a part of it. I see patients who come regularly and they just get cavities all the time. And it just depends on the enamel, like how thick it is. Do they have a lot of thicker covering to their teeth that protects them? Everybody's so different. And it's just that what cards are dealt to us in life, and we just got to know how to take care of it. So what I do is I do more of like a holistic approach at my office. If you guys ever wonder, my patients come from afar. They find me on TikTok, so I'm very grateful for it. But I do a very thorough exam. And what I try to do is also create a very positive experience throughout the whole procedures, whatever it is. It could be a deep cleaning, fillings, crowns, extractions. My patient, of course, got to wear headphones, listen to some music with noise canceling headphones, essential oils. I also turn off the overhead lights so that they can relax and really just kind of like zone out. And most of my deep cleanings process usually just requires a prescription numbing gel. I use this amazing numbing gel called the Best Topical Ever. It is for only professionals, of course. And in this case, this patient actually needed a dental shot. It was so severe that it couldn't fully numb up his teeth and gums for the procedure. Now, I also do a really cool technique, and I want to share it with you guys. I learned this from a dentist, I would say about 15 years ago. It is a acupressure technique. And I don't know if you guys know, but your brain can only sense one pain at a time. It's kind of like if you had a headache, and if I took a hammer to your knee, well, your headache's gone, but your knee hurts, right? So your brain's kind of like going back and forth. So my assistant will actually put a lot of pressure on the forehead and vary it. And basically when I give the dental shot, they don't feel it as much. So it kind of alleviates the pain or the pressure that comes with it. So I really try to make it really relaxing and a great experience throughout the whole procedure. And I also make sure I Vaseline their lips. This is so key, you guys. If your dentist or hygienist is not doing this, is so important because I don't want them to get chapped lips. I don't want them to bleed whatsoever. And then basically I wash them, and I always keep an eye on them, on their eyes, their body motions, and their hands, because I can tell if they're tense and they're afraid to tell me. I'm always very cognitive to make sure that they're comfortable in my chair, because I want to baby them throughout this whole thing, because then they'll feel comfortable to actually come back to continue the care that I have for them. So that's what I want to do, and that's what I had created for him. And he felt so great afterwards that I'm so glad that he's so comfortable to see me, because I just saw him last week with his wife, and he's just comfortable. And I love that he's able to like face the music again and just feel like, all right, like this is how it's going to be, and it's not so bad. So you guys understand that there could be so many factors, and that was just one, the fear, trauma. Another reason could be depression. I've seen this a lot of my patients. They just don't want to wake up and get out of bed and brush their teeth sometimes. It could be days, it could be weeks, it could be months. I've seen patients where they had to deal with a death in the family and they couldn't take care of themselves because they're busy taking care of loved ones. You know, sometimes I see this in moms. I know moms are guilty of this, that they'll put their husband or their partners and their kids before them. And before you know it, they're so dead tired at night, they're not able to brush their teeth. And this can happen. So there's so many things, you guys, and it could be also lack of knowledge of not knowing how to brush. Or once you get to that predicament, the stage in life where it's so much buildup, what do? Some people don't even also have the lack of funds. So that's why I really want to try to instill learning how to take care of your oral health at a young age so that this doesn't occur. And I'm so glad that my patient who, finally decided to come see me, he's not instilling that fear to his kids that they're going to have a positive impact. so that they don't have to go and repeat the cycle of what's happened to the dad and also to the mom. So it's really important that, you know, the positive environment that that I instill onto my patients, especially at a young age, that is going to create a positive impact, that they're willing to go to the dentist when they get older. And that's the goal. And I know you guys had a lot of questions about it. How can you prevent this? Going to the dentist regularly is what's the key thing. Brushing twice a day and flossing regularly, mouthwash, but going to see the dentist either every 3, 4, or 6 months. Not once a year, not when you feel like it, not when it hurts. It's the key thing is going regularly. And everybody salivates, I always say, differently. Everybody builds up differently. Everybody has a different genetic makeup. Everybody has through different conditions and what they're going in life. I've had patients where they were doing great, and all of a sudden they went through a depression lull stage. Something happened, and then they fell apart, and their oral hygiene got bad. But it's okay. I'm here to pick them up and get them back onto the horse again, and then carry them on through it, and so that they don't relapse so heavily. And it's okay. And I hope you guys are able to find a dentist who can be compassionate, empathetic, and just not judge you for what's going on in life, because nobody is perfect. Nobody. We just need help, and we need a lot of mentoring. We need a lot of care for each other so that we can all do well, because oral hygiene is such a key factor of the overall body health. I always say this is the engine to the car, and if you guys take care of this, you guys will live longer. 10 years on average, studies have shown. You're able to reduce heart disease, diabetes, and also risk of Alzheimer's, dementia. Yes, it is connected to the brain, and that's a whole nother video I gotta talk about. But take care of this, you guys. You guys will be able to eat, enjoy food, live a great long life, and just basically be excited and take care of yourself, because teeth is one of the 2 things that a person will be noticed about, their eyes and their teeth. So take care of yourself, you guys. I have so much more videos, you guys, about deep clean. So if you guys love it, please follow and like and share the video, and I will see you next time.